I'm here with Sydney and we're going to check her musculoskeletal system. First, we're going to start with her head. We're going to check the transmandibular joint here. What I want you to do is I'm going to have you open and close your mouth. I'm going to have you move it side to side, and I'm going to have you protrude it out while I'm holding here. Okay, open and close, side to side, and I'm going to have you protrude. Okay, good. I didn't feel any clicking or any discomfort there? No. All right. Next, we're going to check your cervical area. Do you have any pain or any tenderness here?
No.
No. I'm going to have you put your chin to your chest, and then I'm going to have you put your head all the way back, and then I'm going to have you put your head side to side, and then I'm going to sort this way and that way. Any pain or discomfort there?
No.
Okay. Pressure on my hand, good. Now pressure on my hand that way, and pressure on my hand that way. Good, you have good range of motion and good. Now we're going to check your spine area. First we're going to look and notice that your area of your cervical neck is concave, the thoracic area is convex, and then it goes back into concave in the lumbar area. I'm going to palpate for any tenderness in the vertebral column, and I don't feel anything. Are you tender at all? No. Okay. Then I'm going to notice that your shoulders are equal, your hips are equal and symmetric, and I'm going to ask you to bend forward. Okay, I'm going to look and palpate. I just feel the column of the spine. I don't feel any areas of lumps or bumps, and any tenderness there?
No.
Okay, you can stand up. All right, first I'm going to ask you to hyperextend your back, which is bending backwards. Good. And then I'm going to have you stand up straight, which is extension, and then lateral bending is to the side and then to the other side. Okay, and then I'm going to have you rotate, standing in place, rotate your hips this way and then rotate that way. Good. Next I'm going to check your shoulders. I'm going to check the joints. Any tenderness in this area?
Nope.
I don't feel any swelling or anything. Next I'm going to have you flex your arms. Your arms go all the way up. That's called flexion. And then arms straight down is extension. I'm going to have you move your arm back, that's hyperextension, and then your arm straight out, that's abduction, and then across the front of your body is adduction. Now we're going to have you put your arm across your back, and that's internal rotation, and then up over on your head, and that's external rotation. I'm going to check the strength of your shoulders. I want you to shrug your shoulders evenly, nice and strong there, and you have +5 strength. Thank you. Next, we're going to check your elbows. First, I'm going to feel, keep your arm bent, any tenderness in that area?
No.
I don't feel any swelling or any nodules. Then I'm going to have you just sit with your arms bent. If your elbows are bent like this, if you go up, that's flexion, and if they're straight down, that's extension. If you put your palms up, that's supination, and if you put your palms down, that's pronation. What I'm going to do is check your strength. I'm going to have you push up with your arm. Good. I'm going to have you push down. Good. And I would do that both hands. Very good. Okay. Now we're going to check your wrists. I'm going to feel your wrist for any tenderness. Anything there?
No.
No. No lumps, no bumps. Okay.
Mm-hmm.
Now we're going to bend your wrists down. That's called flexion. Hands straight out is called extension, and up is called hyperextension. If you take your hands and you move in towards your body, that's called radial deviation. And if you move them outward, that's called ulnar deviation. The radius is on this side and the ulnar is on that side. With your wrists flexed, I want you to push up against my hand, and I can check the strength. Very good. Now we're going to check your fingers. I'm just going to palpate all the joints to make sure there's no lumps and bumps, any tenderness in any of those areas?
No.
No. What I'm going to have you do is make a fist. That's called flexion, and open your hand is called extension. Okay, if you open your fingers wide, that's called abduction. What I'm going to do is if you take your thumb and you move it towards your little finger, that is called flexion of the thumb. I'm going to have you squeeze my 2 fingers, both hands. Nice strong grasp there. And then I'm going to have you make an OK sign. And I'm going to try and pull your fingers apart. And you need to try and keep it strong. Very good. You have +5 strength there. Thank you. All right, I checked your hip. Now lift your leg all the way up. That's flexion. Put it down, bend your knee up, and that's flexion of your knee. Good. Now I'm going to have you put your leg out to the side, and that is called abduction, and then across your other leg, and that is called adduction. I'm going to have you bend your knee up, and I'm going to have you rotate it out this way, and that is called external rotation, and in is internal rotation. Very good. I'm going to have you push your leg up, okay, and then with your leg up, push your leg down. Good. And then bend your knee up, and I'm going to have you push against my hand. This way and then this way. Good. Nice, good strength there. Now I'm going to palpate your knees. Any pain there?
No.
Okay. And no swelling noted.
No.
I'm going to check your ankles and your feet. I'm going to have you move your foot up. That's dorsiflexion, and down is plantar flexion. I'm going to have you push against my hand and push against my hand. Good. I would do it to both feet. Next, we're going to have you turn your feet in, and that's called inversion, and then out, and that's eversion. Now I'm going to check the strength of your knees. I'm going to have you push backwards on, okay, now push forward. Very good strength there. And now I'm going to check the carpal tunnel for the phalanx side. What I want you to do is put your two hands together, and you hold that for 60 seconds. If there's no discomfort or pain, then that's good, it's negative. If you have pain or discomfort, that would mean that's a positive phalanx sign. Now we're going to check the Tinel sign. We're going to check 2 fingers right over the medial nerve area, and we're just going to tap that area, and we're going to see if you have any discomfort, numbness, or tingling.
Nope.
Okay.